October is World Menopause Month, and it's a topic that has largely been something women dealt with in silence. But lately, there's been a push to talk about this transition in life. Even A-list celebrities are raising their voices. So joining me now to talk about what it is and how to navigate this time in life is Dr. Shayla Garnica. She's a menopause specialist. Great to have you back on the show.
Thank you for having me again.
Yes, and why is this so important that we have this conversation?
It's really important because I think what we need to do right now is change the negative perception that social media and society has about women going through menopause transition and being menopausal. I want women to take the opportunity of this phase in their lives to celebrate it.
Okay.
Our body has been kind to us. We have experienced a lot of things because our body has allowed us to go through a lot of difficulties, blessings, challenges, and there's a lot of wisdom in that.
Yeah.
And there's growth, and that is something that we need to value.
Yeah, absolutely. I mean, we are giving life, you
yes,
know,
we are.
And then, yeah, to celebrate this part of our lives, you know, everything's changing, and it might be tough to navigate it at first, but if we understand it, I think knowledge is power, right? And we
Correct.
can go through it, and we can be a little bit more educated and know exactly what's going on.
Correct.
So there's different phases of menopause, right?
Yes. So when we talk about our reproductive age, we kind of divide it like in three. You have the first phase of reproduction where you have the ability to conceive, give life, like we were talking about, and we have a determined cycle or pattern for our menstrual cycle. Then you have the phase of menopause transition where this cycle is no longer predictable and it becomes erratic.
Yes.
And then you have menopause, which is the lack of those hormones that we were receiving before.
And everything stops.
And everything stops once you become menopausal.
Yeah. So navigating this, it seems cut and dry, but it's very confusing.
It is.
And how do we know where we are in these stages?
I think what needs to be clarified is that like the definition per se of menopause is not difficult. It is 12 months without a period.
Okay.
You can have no periods for 8 months, and if you start a cycle again, then we have to restart the timer.
Okay.
Again. So then it has to be a year. The part that I think is confusing is that not one shoe is going to fit everybody. There's a lot of factors that vary, and there's a lot of depends in the process of transitioning.
Right.
Okay, because we need to know what your cycles were doing before. Were you on birth control? Were you not on birth control? What type of birth control were you on? Do you have a uterus? Do you have surgery? So there's a lot of
so many
maybe
right.
depends. So it has to be individualized.
Is there a point where I should be concerned about something?
There should be a point when things are not transitioning as how we would expect it.
Okay.
We have certain definitions of what we would call early menopause and what we would expect for normal transition. Our normal transition is anywhere between 45 to 56 years old.
Okay.
What we would consider early menopause is anything between 40 and 45 years old. Premature menopause is anything before 40.
Okay.
So that's when we have to look at other medical problems that could be underlining and kind of clarify what needs to be done.
Okay.
But you have like 4 to 5 years where we're transitioning, and there's a large gap of age where you can be going through it or being after.
Right, there's so much going on. Let's talk about wanting to know what my hormones look like.
Yes.
Going to the doctor and saying, all right, I want to do a whole blood panel and check my hormones.
Yes.
You say not necessarily a good idea.
Correct, that's
Why?
what we talked before, Natalie. That is not something that's going to be helpful for patients, because if you understand what is going through menopause transition, your hormones are not following a cycle. They're erratic. So it's a moving target. You can have a level of hormones today that represents a certain part of your cycle, and then tomorrow it represents something different.
Wow.
So it doesn't really mean, it doesn't really mean anything. I think that, and that's also as part of the confusion of the whole transition. What really is important is how are you doing as a whole?
Yeah.
What are you feeling? What are your symptoms? Are they bothering you? Are they not bothering you? Can we do something about it? That's where we need to put emphasis, not on check my hormones.
Yeah, I do. Talking about symptoms, I have a graphic that I'd like to, put up on the screen because, yeah, how are we doing? We're not doing so good. I mean, look at all these symptoms. I mean, we're talking everything from sleep, which I think affects everything,
correct,
to migraines, dizziness. I mean, bone health, weight gain. There's so many things, even heart palpitations and cardiovascular issues. So there are so many symptoms, and for everybody, it could be something different, right?
Correct.
So how do I know, like, okay, this is normal, and then maybe I should get, some of these things fixed? How do I fix it?
Absolutely. So, when you're going through the transition, we know that 70–80% of our women are going to be having vasomotor symptoms, which are the hot flashes, the night sweats. These can be accompanied by chills, anxiety, and all those fluid symptoms that you talked about. It's really important to clarify any underlying diagnosis that might be overlapping all of these symptoms. I don't want women to think that all of these symptoms means that I'm going through the transition. Maybe, maybe not. That's why, again, you have to have a team available, somebody who is a menopause specialist that can help gather information, guide you in the right direction, and you need other specialists to also clarify any underlying diagnosis and treat it.
Yeah, one of the things that we were talking about is have a team, have people, doctors, and don't be dismissed either. If you have one doctor that just says, oh, this is just normal, just suck it up, go and find somebody else. Yeah, and don't, there's no reason to suffer in silence because there are ways that we can navigate. And you said to celebrate it. Like,
yes,
it is a time to celebrate. We've lived long enough, right?
There's a lot of value in all of the challenges that we have accomplished.
Yeah.
And as we age, we need to be equal to our counterparts, which are men, valuing everything that we've done. So women need to be informed, educated. Nobody should be dismissing their symptoms. You need to have a good team by your side.
And advocate for yourself.
Yes.
Yeah, absolutely.
Make it a successful transition.
Yeah. Dr. Garnica, you have a wonderful website. I want to tell people where they can find you. Muddy Lotus, which I love the reason why you came up with that name, and it's on the website. So definitely go and check it out. And there's the 800 number as well if you want to contact Dr. Garnica for more information. Of course, we're going to have you back next week, and we're talking about treating some of these symptoms, and we'll talk about
Sounds good.
hormone.
I'm excited.
You don't call it hormone replacement. You call it
menopause hormone therapy.
Yes,
ma'am.
We'll talk about why. Thank you so much for being here.
Thank you.